Welcome to American Dreams. My guest today is Steve Marler. Steve, welcome to today's show.
Thank you. It's great to be here.
So, Steve, I want to discuss advanced longevity. For the listeners here, it's quite a program that you put together. I'd like to share the inspiration behind why you started this.
So about 13 years ago now, we started doing early detection screening because of an event that my mother went through with a late-stage cancer diagnosis. I'd been around the technology of screening, scanning technology, MRCT, for several years, and it dawned on me that we should be using this. And so I started studying it and saw a few areas where people, especially in the heart, were doing some screenings. And that's kind of how I got started. My mom went through a very terrible ending there because of the late-stage cancer. So we got the technology set up to do these screenings, and very quickly we realized we were onto the right, in the right space, because the medical community went nuts. They were screaming at us, why are you scanning healthy people? You got people with no symptoms. What they called healthy were people with no symptoms. So, I literally had a doctor from one of the largest heart hospitals bust through our door one day, and I say bust. He was just like, what are you people doing here? You're scanning asymptomatic people. That's not right. It's unneeded, uncalled for. You're going to just scare a bunch of people. Well, after about a year of sending dozens of people to his heart hospital that had, asymptomatic heart problems, he decided that this wasn't quite so dumb as he thought. And we knew we were on the right path. And of course, since then, we scanned over 150, 60,000 people, 3 locations, and we found thousands of people with early detection of our screenings that's been able to get help, right away and change the outcome. The outcome is almost always better if you find it early.
Yeah, see, it seems such a simple fix, what you're doing. But what would you say needs to be done in order for us to fix our overall healthcare system to focus on keeping people healthy rather than just treating disease?
I knew you were going to take me here. Our outlook on the healthcare system is simple. We have to change the way that doctors are allowed to practice. I know hundreds, maybe thousands of physicians, people in the medical industry, and they all have one thing in mind. They want to be a provider. They want to provide the care the patient needs. Unfortunately, the way our system is structured, it's controlled by the payers. And of course, the largest payer is the government. But your commercial bucas are just as bad or are just as structured. I don't want to get off into a hole here, but the doctors can't be doctors. They are beholden to what the medical community will pay. The payers will pay for their services. So until we change the system to being a more proactive, as we do every day, looking for early signs of these diseases and pay for those through our structured healthcare insurance programs, we're never going to get better. And that's our goal. We got in the surgical industry on a self-pay program. It was so effective that, one of the big systems came in and joined forces with us. And we've since sold out to that group because they are trying to change their model as well. And it's happening. It's out there. There's a groundswell of understanding what needs to be done. It's just that the entrenched groups are so strong and so embedded that it's going to take a lot more than just me and a few others to make it change.
Well, I'm sure a common question is, Steve, I'd like to use your program, but will my insurance pay for it?
Every day. I could pull up Facebook right now. There's 100 questions. How, what does insurance pay? Does my insurance pay? Every day. We hear it daily basis. And the key is, if you think about it, they're conditioned to have insurance, whether it's through your employer or on your own, and you don't seek care. Well, I got this huge deductible, I got this big copay. You have to take control of your health. And the simplified version of that is you put your money in. The government's trying to help. You've got FISA accounts and things you can put money in that tax before tax that can help pay for certain medical items. But then you get a cap policy, which is very inexpensive, has a very high deductible for in case you have an event that takes massive healthcare intervention. And with that said, we have a great medical system. The payers are the problem. We have the best facilities and the best doctors. Doctors from all over the world come to the U.S. to practice because of the system and the abilities that our doctors have here in the U.S.
I've often heard, sometimes as diseases are treated, the patients are kind of at the mercy to which the insurance companies are willing to pay or the treatment process. So if I want to go through your program here, what do most people do? Do they worry about having their insurance pay for it, or do they usually just go out of pocket?
It's all out of it. Go into the system and explain how it works. People get it. They want to have this service. They want to be out of that, controlled payer system. And, we have people that pay out of pocket daily. We also finance it. We have easy ways to get into our programs. And when I say programs, these are multi-year early detection programs. We want you to get a baseline data set today. We do all of these screenings in the first day. Then you have a consult on the findings. We have cardiologists, medical doctors, radiologists, interventional guys on staff. There are employees that's going to talk to you about these findings. And they're going to tell you the way it is. They're going to give you this data. You're going to get radiology report, calcium score reports, and we're going to give you the information to take to your physician as well. We encourage you to take this information to your physician, and they can communicate with our medical staff as well. Keys to get a baseline, and then come back. We monitor you depending on which program you're in, quarterly or biannually, but at least every year you come back close on or close to your anniversary date. We do another set of data, and now we've got comparative analysis. And that's what we need in our medical system. And for the most part, it's not available unless you pay out of pocket.
So can you tell us a little bit about the body scans that you do and why it's important to diseases detection before they actually appear?
Sure. The body scan looks for all major diseases. Of course, heart disease and cancer are 1 and 2. Heart disease is an interesting, there's multiple ways to have a heart attack, but the main way is there's calcium blockage in the vessels in and around your heart. And the thing is that is a slow, long-term progressive disease, and it can be detected at the earliest stages. And the technology's been around for 20 plus years to do it, but it finally, got enough traction where people would come and pay for that service themselves. It's been fantastically successful at addressing early stage heart disease. Cancer, we look at all your major organs. We not only look for cancer, but early signs of it. We look for tumors. We look for, any type of abnormality that's there typically leads to some type of disease, whether it's in your kidneys or your digestive system, your liver, pancreas. We go through all of those organs in the scan itself. Now, our scan is done on a late generation CT. As a matter of fact, as of this date, about 3 weeks from now, we are installing the latest technology CT. It's called the Genesis 640. It's a 640 slice CT. I can scan the entire body in about 15 seconds. It's painless. There's no needles, no dyes. It's the fastest and most comprehensive medical test that's available today. We'll be the only freestanding center that has this machine. It's typically in a research facility or in, your big hospital cardiac systems. But the body scan looks at all your major organs, vessels, looking for early signs of disease.
Okay, so you sold me. I'm interested in getting a body scan. Now, what do I need to do in the process to actually, walk through and work with you as a new patient?
So obviously we're going to schedule a report. We're going to get some pre-information from you. We'll send you a link to fill out a questionnaire. When you come into our office, we're going to do a consultation. And that consultation is the key. We're going to look at your previous medical history. We're going to look at your family medical history, and that gives us an idea of what you have. We have additional programs. We're going to do a full genome decode of your DNA. We're going to do some blood panels, obviously, before you come in. We're going to send you the kits to do that as well. And then we do a full assessment of you with our screening technology. There's you hear a lot today about whole body MRI scans. And to touch on that, the MRI is a great technology, but it was never designed to do large area scans. If you think about an injury, you go to your doctor, he writes you a script. It's for a specific area. So your shoulder, you've got pain. They write you a script for a shoulder scan. They put a coil on there. The MRI looks at that area, does a great job, takes 30 minutes or so. And then, the radiologist just reads that area. So, they're trying to use it today for whole body. It doesn't take a continuous scan. It's multiple scans that have to be stitched together by software, and it cannot read calcium in the vessels of the heart. It's the number one killer. So, and the full whole body takes about an hour to do. A lot of people are claustrophobic. It's tough to sit in there that long. That said, we use MR, 3T Tesla MR for brain scans. It's fabulous at doing that. We do an MRI, MRA as part of our service. It does have an AI overread, and it is a true AI. A lot of people use that word, throw it around everywhere today. I think my refrigerator's got AI nowadays. There's so much of it being said, but it looks at your brain matter. It looks for volumetric. It also looks at loss of volume. And then the MRA switches over and looks at all the vessels in your brain. We're looking for early signs of dementia. We're looking for possible strokes, aneurysms, tumors, all types of things in the brain that the MR is great at. It's just not great at these large area scans. The rest of the body we're going to scan with our new generation CT. The entire process, including the brain scan, takes about an hour. Afterwards, we're going to result you with one of our medical professionals. As I said, you'll get a report, you'll get a copy of all the images, and then we're going to load all that into our database. So it's there for your physician to look at, but it's also there for the next time you come in to do comparative analysis to see where you are and what's changed, if anything.
In terms of accessibility, how much does a full body scan cost?
So, the range today, depending, there's some variances there. We do all types of scans. The range is from about $2,000 to $4,000, depending on what all is we do. Types of scan, we do virtual colonoscopies as well. We also focus on your thyroid and the vessels in your neck using ultrasound. So all of that as a package is around $4,000 just for the scan.
Okay. And then that also includes all the pre-work, the blood tests, surveys, and all that.
So there's an additional charge for that piece. A lot of people choose to just do the preventive screenings. I say it's really early detection screenings. If we see it, technically it's already there, so it's more of an early detection screening. We do have an all-encompassing package that does all of those programs, put you on our concierge program for a year. So you communicate with our physicians, you get quarterly updates as well. That program gets into the mid-teens for all of those services. So around $15,000 for that entire program.
And then that would include roughly how many scans a year, or what is the process? Is it a quarterly review or?
So scans technically we do once a year, but if we have findings, a key point, I'm glad you brought that up. If we do see something that we do need to do a more specific scan on with contrast, for example, that's included in the program. There's no additional charges for any follow-up scans that we do. The virtual colonoscopy I touched on, there is prep similar to what we do with a traditional colonoscopy, but it is all virtual. So there's no meds. I say a little bit of prep. You sit down on the table for about 20 minutes. But the key metric there is we can go all the way through your colon, which you can't do with a scope. There's no risk of infection, no risk of perforation. And we can also see the outside of the colon as well. A lot of times the problems start on the outside of the colon before they're visible through a traditional scope.
You've done this a number of times. Roughly how many people have you scanned over the course of time with advanced
We're
longevity?
we're around 160,000 today,
Wow.
with
Wow.
countless thousands of success stories of early detection that's got help and changed the course of their disease.
Well, I imagine that with the announcement of the Genesis 2 coming out, that a lot of people are getting signed up for that.
We've had great interest in that. The key is not only the technology so fabulous. I could spend an entire podcast talking about all of the great new things that this machine does, but it's so safe and it's so fast. But you don't have to change clothes. You get in the way you are. Most facilities, you're going to have to go in, change clothes. There's a lot of prep. They want you to fast. None of that. This thing is truly Star Wars level, and I'm pretty excited about having this machine in there. But yes, anytime I mention it, they're automatically saying, I'm in. When do we get in the machine? Howard, you mentioned earlier, is one of those guys.
Oh, fun. So what location is that machine going to be at?
The machine's going in Houston at our Bel Air location. Bit Newcastle, if you're familiar with the streets in Houston. The second one will be installed in Plano about a month later. So end of May for Houston and the end of June for the second one to go in Plano.
Okay, so can you give us, just on the final note here, a couple success stories of people that have gone through the program?
Sure. One of the ones I really like to talk about is a physician that I've referred patients to for many years, and I had tried repeatedly to get him to come in and get a scan. It's kind of like the mechanic with broke down cars in his yard. He finally agreed. We had a finding. And as I said, we did a follow-up with contrast. And while we were doing that, the MR takes a little bit longer. His wife was waiting in the waiting room, reading Better Homes and Garden. I had never met her. I stopped and said, hi. We got to talking about the scans. And I said, you know what, since you're here, let's do a body scan. There's always a little bit of resistance. So like, well, do I really want to know? That we go through that discourse. She gets in the machine, and again, it's really fast. So she gets in and out. She's done about the same time the doctor finishes his follow-up scan. They're heading down to, sadly, a town that was destroyed by a tornado a few days ago down in southern Oklahoma here in Sulphur, and to a little resort. And they were driving. They had left. It's late in the afternoon because he came out of the clinic. Dr. Sparks, who's our staff radiologist, called me and said, are they still there? And it's not good to get a call right back from him, unfortunately. The story, the short version is he actually had cancer, identifiable cancer, and I've got a disclaimer for him to talk about this. I don't talk about it. I don't give his name, but he's actually done a video for us. But the interesting thing about it, his wife's sitting there in the waiting room reading a book with completely asymptomatic, had a kidney full of cancer. And so he called them. They were a few, an hour out, I guess, by the time the radiologist called them. They turned around and came back. They immediately got her seen, and within 2 days, she had significant surgery to remove this cancer, and they're both doing great today. So again, a medical community, he is a bedrock of the medical world here, and it shows you that you don't have symptoms. You can have these advanced stages of these diseases. And I could go on for hours telling stories about this. And it's not just physicians. I have a great ambassador for our company that's a school teacher in Western Oklahoma as well, that her husband's side of the family had severe cardiac disease. They multiple had passed at early ages, what I call late 40s, 50. And so she saw us in an event. They came in and did this couple scan that we do, heart lung scan. And lo and behold, he was fine, but she also had kidney cancer. So again, completely asymptomatic, had no idea. She got help and is doing great today. So we have thousands of those stories. And that's what puzzles me as to why the medical community, payers don't get behind this.
For a person interested in signing up for the services, how would they go ahead and reach you?
Yeah, so they can give us a call at 833-411-7226. That's 833-411-SCAN. Or you can go to our website, advancedlongevity.com, and click the link and get more information. Fill out the form and we'll get in touch.
Well, Steve, it's been a pleasure having you with us today here on American Dreams, and we'll look forward to also hearing updates from you when this Genesis comes out.
We'll get you in to see the machine. And
thank you.
We need more people like you spreading the word.
Thank you.
You're welcome.